everyone, this is Dr. Schroeder with this week's video introduction to week number 8, our final week of class uh, for our course in the principles of staff and patient education. And once again, a very robust, very good week of discussion. You've been busy. You had your discussions to get done and you had your presentations to do. And so I continue to be very impressed with the level of discussion in the class. It's difficult in a class this size to get really into the discussions too much just because there's so many of you. And but there's a lot of really good topics that were brought up this week. And so most of my feedback was in the class this size. It is typical that I will really just give feedback to maybe correct some misperceptions or to bring up some new insights. But the things that were discussed this week were all very good in all the threads. The focus, of course, was on QSIN. QSIN is a acronym that's been around for about 10 years now. We've been, but over the last few years, it's become very much a focus of all things in nursing education, not only in nursing programs, but also in staff education in hospitals. And we have, of course, these 6 areas that you're all well aware of by now. Patient-centered care, teamwork, evidence-based practice, quality improvement, safety, and informatics. Now, these are all topics that you've covered in various degrees and in various ways all the way through the program. And this week was really talking about how do we integrate them into some sort of a cohesive plan for providing education to staff in a hospital or in a healthcare setting. And several things were brought up. Most of you had discussed how you are implementing them either in your own hospitals. The big ones that were mentioned were things, for example, like fall risk. Fall risk is a very big area of safety, and in many different areas. The geriatric fall assessments are different than the ones that we have in pediatrics, and some of you had mentioned the challenges that we have in coming up with really good tools or really good assessment tools. But really, with all of the things that we do in QSIN, the idea is to have students, or excuse me, have staff develop the knowledge, skills, and abilities to be able to implement these interventions and to assess them appropriately. Really what it boils down to, and it was kind of buried in the reading this week, but it really kind of comes down to critical thinking. We want our students to be able to, or we want our staff to be able to critically think and to be able to analyze and be able to anticipate problems before they occur and know how to intervene when they do occur. So that's why we have all these competencies. We list them as competencies, the things that they have to know how to do and have to understand. Sometimes it's very simple, like hand washing. Hand washing is fundamental to what we do in nursing. That's why we teach it so much. The challenge is doing it and not having it become just like a fire drill that you do over and over again, that everybody just kind of sort of really loses the importance of it. Building teamwork and camaraderie, where you have staff that feel safe in bringing up and mentioning safety issues. This is a big issue, not so much in hospitals anymore like it used to be, but at one time this is really a big problem where nurses would sometimes see and recognize safety issues, but would fear retribution if they brought them up because they would be looked upon as being, negative or being not supportive of the team or those sort of things. That's really a big deal, and so we'd spend a lot of time in staff education. It kind of sort of wraps us around at the beginning of the class when I talked about the staff educators being a leader on the unit, because we're the ones that really have to support and champion all of these changes. And so once again, very good week of discussion, and I will be grading your presentations throughout the week. They'll all be done by the end of the week. And it kind of sort of wraps us around into week 10, which is a great way to end up, because in a sense it's kind of where we started again. And we're going to talk about systems of care, systems of organizations. And this is another really important part, as I just mentioned. Nursing educators are leaders. We have to be leaders. We have to be the people that are really identifying and steering and guiding change. And that can be difficult in today's healthcare systems because we're dealing not just with our own individual units, we're dealing with multiple disciplines. We're working with doctors and with social workers and with respiratory therapists and a lot of other different agencies, both in and outside of the hospital. We're dealing with new medical terminology and new medical equipment, new forms of informatics. And we need to be able to navigate that and help our staff to be able to navigate that. So that's really going to be the focus this particular week. And we're going to end our discussion talking about how we deal with these complex issues. And so you're going to be identifying some of these issues and how they can be dealt with. And I want you to just think in terms of what are the change agent roles that you could see yourself playing or that you would have staff playing. I think that that's a good way to approach this particular discussion question. Housekeeping matters because this is the last week of class. It is short. We don't go through the weekend. So all the responses, I'm not going to change the syllabus in class. It is listed as Friday, so you have until Friday at midnight to post your final responses. Technically, I'm supposed to have the grades due on Friday, but they're, I think, wanting us to take class up through Friday, so the final grades will be done by the weekend. But I'm not going to change the dates that are listed in Blackboard. Initial response due by Wednesday, the follow-up responses by Friday night. And I will be grading those then on Saturday. So it has been my pleasure and my blessing to be your instructor through this class. I have enjoyed it. We have had some great discussions. And I am proud of all of you. For those of you that I've been with before, it's been great to get to be with you again. Keep me in mind as you have any questions as you move forward in your new careers and in your new career paths as nurse educators. And I look forward to hopefully being able to keep contact with some of you either through LinkedIn or through any other modalities out there. Just to, I like to be a mentor. I like to mentor people. So if you need a mentor, let me know. Everybody have a great week. Happy Father's Day today. I'm recording this Father's Day morning. And we'll look forward to seeing you in the discussion forums.